For Fox 10 News is committed to your health, and November is American Diabetes Month, so doctors are warning about a potential problem for people with diabetes that they may not know about. Researchers say roughly 1/3 of people who have long-standing diabetes will develop eye problems, and that's why they say it's important for people with diabetes to make sure they have those regular eye exams at least once a year. Dr. Joe Fontenot is the medical director at Community Services for Vision Rehabilitation. He's in the studio to talk about how you can take care of your vision if you are living with diabetes. And I guess first off, we have to ask, in terms of the prevalence, how many people in Alabama have diabetes?
It's estimated that about 15% of adults in Alabama have diabetes. Now that's an awful lot of people. It's almost 500,000 people.
Right. And we're talking, type 1 and type 2 diabetes.
Right.
But in terms of this eye condition we're talking about, who's affected by that?
Well, the frequency of eye disease in diabetics is very high. It's almost 50%. And of course, a lot of these people who have diabetes are not aware of the potential for developing eye disease. And many of them who have eye disease are not aware of that. So it's important, as you already mentioned, to have an eye exam at least once a year if you have diabetes.
And in addition to that eye exam, is there anything else diabetics can do to keep from getting that eye disease?
Well, they can maintain good blood sugar control, so they can take their medicines, keep their weight down, exercise, those sort of things. And that helps maintain good eye health. And if they do have eye disease, it helps slow down the progression of the eye disease.
Okay, so on that note, if they do have it, what's the treatment?
But there are a lot of different treatments available. There are more and more treatments available year to year for diabetic eye disease. And again, most people are not aware of this, but there are some of the treatments will actually slow down, will retard the progression of diabetic eye disease.
So you say most people don't know. How is it that they don't know? They're not symptoms?
Well, there are symptoms, but those symptoms develop late. You can pick up early diabetic eye disease even before you start having trouble seeing. And that's where the dilated eye exam on a yearly basis comes in. That will help pick up the disease early, at which time it's more amenable to treatment.
All right, and so on that note, those eye exams are definitely important. I want to thank you, Dr. Joe, for coming in.
You're welcome. Thank you.
And you can watch this interview. We'll have it posted for you on fox10tv.com shortly, so you can share it with someone you know. Speaking of someone you know, meteorologist Chastity Bird, we're going to be checking in with her in Bay Minette ahead of the Fox 10 Storm Checker Tour.